Hello everyone. Today, we're delving into the world of a medication called Epidiolex, known by its generic name cannabidiol. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Epidiolex, with its active ingredient cannabidiol, is a prescription medication approved by the FDA in 2018. It's derived from the cannabis plant but contains only trace amounts of THC, the psychoactive component of cannabis. Epidiolex is specifically formulated to treat seizures associated with Lennox-Gastaut syndrome, LGS, Dravet syndrome, and tuberous sclerosis complex, TSC, in patients 2 years of age and older. These are rare and severe forms of epilepsy that often don't respond well to traditional seizure medications. This medication works by interacting with receptors in the brain to help reduce the frequency and severity of seizures. It's typically prescribed when other seizure medications have not provided adequate control or have caused intolerable side effects. Epidiolex is available in oral solution form, making it easier to administer, especially for pediatric patients. Warnings: While Epidiolex can be effective in managing seizures, it's important to be aware of certain precautions. It may cause liver problems, so regular monitoring of liver function is necessary during treatment. Additionally, Epidiolex may increase the risk of suicidal thoughts or behaviors, especially in younger patients. Close monitoring for any changes in mood or behavior is crucial, and patients and caregivers should report any concerns to their healthcare provider immediately. Before taking this medicine. Before starting Epidiolex, it's essential to discuss your medical history and any medications you're currently taking with your healthcare provider. This includes any history of liver problems or psychiatric disorders. If you're pregnant, planning to become pregnant, or breastfeeding, it's important to have a conversation with your doctor about the risks and benefits of taking Epidiolex during pregnancy or while breastfeeding. Side effects: Like any medication, Epidiolex can cause side effects. Common side effects may include diarrhea, decreased appetite, sleepiness, fatigue, and interactions with other medications. However, some patients may experience more severe side effects, such as liver problems or allergic reactions. It's important to report any unusual symptoms or side effects to your healthcare provider promptly. Dosage: The dosage of Epidiolex will vary depending on the patient's age, weight, and the specific type of epilepsy being treated. It's important to follow your doctor's instructions carefully and to use the provided measuring device to ensure accurate dosing. Your doctor may start you on a low dose and gradually increase it to find the most effective dose with the fewest side effects. Avoid: While taking Epidiolex, it's important to avoid driving or operating heavy machinery until you know how the medication affects you. Epidiolex may cause drowsiness or dizziness, which can impair your ability to perform these tasks safely. Additionally, alcohol and other central nervous system depressants may increase these effects and should be avoided while taking Epidiolex. FAQ: Many individuals wonder about the legality and safety of using a cannabis-derived medication like Epidiolex. It's important to note that Epidiolex is a prescription medication approved by the FDA and is legal to use under medical supervision. However, other forms of cannabis products may not be legal or regulated in the same way, so it's essential to consult with a healthcare provider before using any cannabis-based products for medical purposes. Closing: That concludes our overview of Epidiolex. Remember, this information is intended for educational purposes and should not replace professional medical advice. If you have any questions or concerns about Epidiolex or its use in treating epilepsy, be sure to consult with your healthcare provider. Thank you for tuning in.